Well, hello, IBG Inspired by God family. I am doing this really quick video. This was a requested video by one of my subbies, and she is interested in knowing what to expect after you have become a registered nurse. And so, or I don't know if she was saying registered nurse or nurse, it's basically the same. And so I'm just going to go over quickly some of the things that you can expect and some of the things to look out for and some of the things to just prepare you. First of all, just know that you have not learned enough in school. And it's not the fault of the instructor or the school or anything else. It's just that it is so much, the nursing field is such a vast or such a big field that they could never teach you all of the things that they would need for you to know. And so it's easier for them to hit on different subjects. And then the expectation is once you get out into the work field, then you'll learn more. And so I'm going to say if you are a registered nurse, I'm going to say, in my opinion, that it is best if you go to a hospital and start working on the general medicine floor. And the reason I say that is because that's what I did. I started off as a hospital nurse, and I had an opportunity to work with patients with all types of illnesses and diseases. And so I had a chance to work with patients with disease processes such as diabetes, COPD, heart disease, all types of sickle cell anemia, drug abuse, uh, um, pregnant mothers. On general med, you get an opportunity to work with everybody, and so it opens you up to really knowing about all of the things that you learn in school. And then after you've been in general med, on the general med floor for about a year, then it's smart to determine where you want to specialize. So then you can go to oncology if you want to be a cancer nurse, or you can go down to the step down unit if you want to have more of emergencies and things like that, or you can work the emergency room, or you can be a surgical nurse. There's just so much that you can do after you've become a med surg nurse. Now, I do know that there's nurses who go straight into a specialty. I just can see the difference in the knowledge base from a nurse who goes straight into the specialty opposed to a nurse that goes into general med and then goes into a specialty after they've got to learn a little bit about everything. That being said, according to where you start working, if you start working in the hospital, there's a lot more training for you in the hospital, a lot more detailed training for you in the hospital. And so you can go a little slower than the expectation of what a RN is expected to do in like a nursing home or something like that. Because in a nursing home, it's almost like the expectation is you are RN, therefore you should know. They should have taught you this. And a lot of things are skills. And some skills you won't know until you have to do those skills and until you have to do those skills over and over and over again. And so it'll be difficult for you to go into long-term care and or LTAC and really learn the skills that you need um, to be able to go out, and it's according to what you want out of nursing. And I just don't see that the registered nurses who go into long-term care first. Now, I work in long-term care as an educator, but and as a matter of fact, when I got my licensed practical nurse license, I started off my first couple of months in a long-term care facility, and then I was hired in at a teaching hospital. And that if you can get into a teaching hospital, I am telling you that would be the best thing for you. Get into a teaching hospital, and then that way anything and everything you need to know, they are willing to teach you. And that worked so well for me because by the time I went back for my RN, there was hardly anything that I didn't already know and hadn't already seen. And once I went for my BSN, that just seemed like it, was easy. Now the master's is a whole other thing, and you ain't asked me about that, but that's some anyway. I'm just saying that. I would say what to expect is for there to be a lot more to learn. There's a lot more for you to learn. Give yourself some time to learn the things. Don't be hard on yourself, and don't be hard on the facilities. I see a lot of the new nurses, they're so upset with the different facilities because their expectation is different from what the facilities are able to give to you. But I think in time you will learn the things that you need to learn. Back when I was in school, one of the studies we did, or there was always a question of should you stair step as I did, or should you go straight into your BSN or to your MSN? And they found that the nurse that went straight to her BSN, she may have at the beginning was a little bit slower at knowing the skill things, but within a year or so, she had far surpassed the licensed practical nurses or nurses like that. Not to say that stair stepping you wouldn't surpass, because why wouldn't you know? You're already doing it. But they're just saying that uh, making that as a choice is not a bad choice. Let me see if there's anything else. I wanted to put a couple of clips, and I hope I can put a couple of clips in here of one of our nurses at the facility talking to one of the new nurses about some things to look out for, because you have specialty. This nurse is a specialty nurse. She works with wounds and she sees all types of things. So at the end of this, I'm going to put in a couple of clips so that you can hear this is real conversation with real nursing, and she's really talking to the nurse about her expectation and what she's actually really truly seeing out in the work world. And so I'm going to put that clip out. So I'm going to go ahead and end this video right now. I don't know if I covered the things that you wanted to hear about. Please ask me more questions, so more detailed questions, and then I can talk specifically on that, because it's so much. Nursing is so vast. It's so much that I could talk about. Because there's pediatric nursing, there's geriatric nursing, there's adult nursing, there's cancer, it's so much that you can do. You can be a nurse educator as I am, or you can be you can own your own business as I plan to teach CNAs and different things like that. So it's so many different things that you can do as a nurse. I feel that the nursing field is wide open, and it is truly one of the best fields that you can go into, especially if you are a person who care about people. So if you don't care about people, nursing is not for you. Go work with steel or something like that. And I say that to my class every time I have a class. Don't get into this field for the money. You will never get paid your worth ever, ever, ever. Yes, nurses can make a lot of money, but that's not what it's about, and you'll never get paid your worth ever. And that's just in the health field altogether, because you are the patient's advocate. You are there to work for the patient. You are there to talk for the patient. You are there to love the patient when they don't have a family. I mean, the things that you do go from clinical to just being there for the person, just loving them, talking to them. And so nursing is, to me, it's innate. If you felt it a long time ago, you knew this was something that you wanted to do, you can easily get out there and start loving and caring and being the advocate and being the person that's going to come in and do what needs to be done for the patient, talk for the patient, talk to the doctors about the patients, because a lot of times the doctors depend on us, and that's why we use the ASBAR. And I'm sure as a new graduate nurse, you've heard of the ASBAR, and if you don't know about the ASBAR, let me know and I'll explain that a little more. But now we're even teaching our seniors the ASBAR, and we're doing that so that they'll know how to communicate with the nurses more. Something's on my lip, sorry. So they'll know how to talk with the nurses more clinically, and so that you can get more of some background. As you know, the ASBAR is the situation, the background assessment, and their recommendation of what needs to be done. And you know, our seniors are our front line. So a lot of times we need the seniors. We need to know what they know, because they can help us out a lot when it comes to our patients. And so I'm just rambling, and I can go on and on because I truly love nursing. I could talk about nursing forever. I could talk about all of the different things that I've gone through. I've gone from, I'm not even getting into all of that because that is not what you asked me. But I'm just going to say, if there's anything else that you need, anything else that you need to know, if you're done with school, going back to school, if you're a master prepared and you need a preceptor, because I know I had a difficult time getting a preceptor at that time. So if you need that, or if you're at that portion, wherever you are, just let me know. I'll be more than willing to help. I really will be more than willing to help. So that's going to be it today. Leave me your comments. Let me know what else you need to know in regards to nursing. I'll be more than willing to help. And if you like this video, don't forget to give me thumbs up. Don't forget to subscribe. Don't forget to hit the notification bell. And don't forget to share this video. Nursing is very important, and we need to get out all of the information that we can to anyone who's willing to get in this. But not anyone, because if you're not the right type of person, we don't want you in the nursing field. But anyone that's loving, that's caring, and that's willing to work, we want you in the nursing field. So that's going to be it for now. Stay tuned for the end. It's just going to be a talk with her, really saying what she feels about the nursing field. And I'll see you all in the next video. Bye.
There's a couple of people over there that have leg stuff going on. And if it needs to be changed, you're like, I couldn't get to it. I understand that. Just let me know. But don't just leave it. Because what they're doing is they document it in here, and I think that it's done, and I never look. Right. I don't check behind grown people. We are accountable for ourselves. I keep saying that. Responsibility. She said accountability this year. This is the same as responsibility. We are responsible for ourselves. We know what our job is. We just need to do it. So I don't go and check if you documented on what you were supposed to do. I don't go check if the skin assessment makes sense. I don't check that stuff until there's an issue, and then I'm like, oh boy. Because I feel like what's going to happen is they're going to come back behind my documentation. They're going to go look and see, well, what have they been saying all day or all week or all month about this person's skin? It's going to make you look crazy. You're going to be in office trying to explain why you wasn't, you know what I mean? Just avoid that at all costs. The good thing for you is you have a way to get in touch with me because she has my number, and so a lot of times there are a few aides and nurses that will text me if I'm not here or not, and be like, hey, what is this and what do I do? That's fine. That's fine. I don't mind that, because, and the reason why I don't, we have some standing orders, but I have to find them and pull them out for you guys so that you know what to expect, or you know. If somebody comes in, that's another thing. On the weekends, when people come in on the weekends and we're not here, they absolutely 100% want you all to still put something in as a treatment, because it's a delay in treatment if you don't. We're not here Saturday or Sunday. They come in with something Friday night. You got Friday night, Saturday, Sunday with nothing at all. And so we're trying to avoid that. Just put the order in. If we want to change it, we'll change it Monday. No big deal. We'll have them sing Thursday and they'll change it. Whatever the case is, we'll take care of it. But just cover yourself 100%. These nurses they're not covering themselves. They're not thinking. They're not following anything that was learned in school. I know it's different once you get here versus in school. But don't fall in the trap. I'm telling you, don't fall in the trap. Because I hear it too many times, especially with the new ones. It was a new girl that didn't do the wound care that weekend that State got came. She was a brand new nurse. She was a new nurse, and she was new here, and she looked shook. She was like, What do I say?
So what is the new nurses expected to do? What you said she was a new nurse and she didn't do it. What should she have done?
She should have did her treatments. And if you're not able to do your treatments, if you're not able to document it, put some.
What do you mean by treatments? Do the new nurses know what you're saying when you say treatment?
Treatments. Oh, I didn't even go over the TAR, did I? So treatments are on the TAR. I've had nurses tell me they don't know what. I never look at the TAR. Look at the TAR, please. Please look at the TAR.
Jordan, you know what a TAR is?
It's the treatment administration record.
Okay.
It's right next to your EMAR, which is your medication administration record. It's the tab directly next to it. Oh man, what did I click on?
Go